Welcome to the HealthSpan Collective, the podcast where science and wellness converge. I'm Nicole Doran, and I'm thrilled to have you join us as we dive into the world of regenerative medicine, integrative health, and the latest trends shaping how we live healthier for longer. All right. Good morning, everyone. Thanks for being here.
Good morning. It's our pleasure.
Welcome to the HealthSpan Collective.
Thank you. Thanks for having us.
So today I have the Chief Medical Officer of PUR-FORM, Dr. Joseph Purita.
Good morning.
And our Director of Clinical Education, Bella Sannasardo.
Morning.
So we are doing a deep dive on EBO2 today. So EBO2 is a treatment that is near and dear to our heart because it is not only one of the most popular things we do here at PUR-FORM, but Bella in particular actually travels all over the world to train other clinics and wellness centers on how to do this treatment. So we really wanted to get into the details, especially because recently so many high-profile people have been posting about doing this. We've had Gary Brecka, Mark Hyman, Ben Greenfield, Dave Asprey. I'm sure there's 20 more that Bella could name, big names in the health industry that have been posting about this treatment. And I feel like it's just become more and more popular in the zeitgeist, wouldn't you say?
Mm-hmm.
We've had so many people at conferences now recognize this treatment in a way that it wasn't really in previous years, even though it's been around for how long? 15 years?
No. Ozone's been used for decades.
Okay.
Now, EBO2 itself, probably 15, 20 years.
Okay. And how long have you been doing it, Dr. Purita?
It's interesting. We talked about this the other day. It was probably about 15 years or so of these. I started doing it in the Dominican Republic when we were treating professional baseball players. And these are guys that really wanted to get in their optimum shape. And I said, this is a really interesting procedure. And I said, someday I'd like to bring this back to the United States. And lo and behold, we did. And the rest is history, so to speak.
Awesome. So, Dr. Purita, what is EBO2? Can you break it down for us?
Okay, so EBO2 means extracorporeal, which means outside the body, blood, oxygenation, and ozonation. So basically what it means in a nutshell is we're taking the patient's blood, we're putting it in a contraption, so to speak, where it's basically being ozonated, and then it's being subjected to different color lights, and then it's going back into the body. So all the work is done outside the body. With one exception, I have to kind of say a little bit. Ozone is what we call a prodrug. What does that mean in regular language? It means that the body has to convert it into a form that's utilized. And basically, when the ozone starts mixing with the blood, it gets converted to other things. No ozone ever enters your body. Ozone's fairly toxic to you. So ozone does not enter the body. Its byproducts, which are the magical things, enter your body.
And they stimulate what?
Maybe the better question is, what don't they stimulate? I mean, it's so many different pathways. So let's I call what it does the pillars of ozone therapy. So one thing that ozone does is it basically can stimulate a couple of pathways in your body. Now, remember, the pathways are basically our body's software. Our organs and cells are the computer hardware, and the pathways are the software. So one major pathway that it stimulates is the NRF2 pathway. Now, this is a pathway that is a major pathway that reduces inflammation in the body. It's sort of like the thermostat of anti-inflammation. Okay, very important, because when that pathway doesn't work well, you're talking about autoimmune diseases and things like that. That's number one. Another important pathway is the NQO1 pathway. Now, what does this really do? Another magical thing that ozone can do is ozone will react with basically fats and amino acids. It produces something called ozonides. Now, ozonides, they get into the cell, and what do they start doing? They start affecting the NAD chemistry of the cell. What they'll do is they'll convert NADH to NAD. Now, what is NAD? NAD is a coenzyme that all cells need to produce ATP, which is the body's energy currency. Now, also, NAD is utilized to perform DNA damage repair and things like that. So it's so important. And guess what? EBO2 is helping you make increased amounts of basically NAD. And remember now, the NAD to NADH ratio is very important, because NADH is found in the cell, and ozone makes it into NAD. And that ratio is about 700 to 1. When that ratio doesn't stay around those levels, you can have many bad things happen, like, aging, etc. So that's some of the magic things right off the bat. It also can help release stem cell output from the bone marrow and things like that. And another important thing is because it causes some stress to the patient, it can stimulate something called the p53 gene. Now, what is the p53 gene? p53 is called the tumor suppressor gene. Now, what does that mean? Well, it means that it kind of looks at cells and it analyzes them. And if it finds a cell that really has a lot of DNA damage, it basically says, okay, you're done. We're going to get rid of you. But unfortunately, many times that p53 gene becomes mutated. So if we can stimulate it, hopefully we get it back to working. It can help maybe prevent some cancers and things. An interesting fact is this. Elephants, which are the largest mammals we know of pretty much, except for maybe a whale, almost never get a cancer because they have multiple copies of the p53, unlike people, which we only have one. So that's just some of the things. Bella, anything you can contribute?
Oh, that was an excellent description.
Oh, well, thank you so much. There's a lot of other things that it does too. I mean, there's so many different things. I mean, it just is a wonderful thing. Now, another thing I think we need to talk about, what does ozone do also? It causes oxidative stress. You're going to look at me and say, well, wait a minute now. Isn't oxidative stress something we want to avoid? Yes and no. We start going to something called the hermetic effect, hormesis. What does that mean? Well, it's like anything in medicine. There's always a magic amount of it that works, be it oxygen, be it glucose. Blood glucose is a good example. If your blood sugar gets too low, you'll literally faint, and you could die from it. And if it comes too high, you can go into a coma and you can die from that also. But when it's that special number in let's say around 90 or so, that's the magic number. That's called a hermetic effect, where too low a dose or too high a dose can be the same thing. But when you have oxidative stress, a certain amount of oxidative stress is very beneficial. Why? Again, it starts stimulating those pathways, the pathways that help reduce inflammation in the body. And that's the real key. So when we can reduce inflammation, we're then starting to reduce inflammaging and things like that. So the benefits are just multiple, and we're still learning the benefits. I mean, it's not something that we've got down pat and we know them all and that's it. We're never going to discover any more. We're learning on things too. We learn when we do these things and we figure out how can we make it better. We're basically going ahead and saying, okay, how can we push the envelope more? But we've got to base it on science. We don't just base it on some crazy thing. I mean, I'll tell you something that we've done recently. We have what we call our hemolumin machine. And this is a machine that does photobiomodulation. Okay, so typically we had it was a stagnant thing in that it would be just solid colors. We didn't pulse them or anything like that. So I went to the inventors of it, who are good friends of mine, and actually I've become a medical director for them. And I said, guys, in the biologic world, pulsing of light is very important. It has a much better effect than regular, steady, continuous light. So they said, well, let's change it. So we changed it, okay? And basically now we have our light pulsed. And we also changed one color also, and I kind of did some research on this. We had an amber color, and we said, let's get rid of the amber and let's use infrared. And by using infrared, I found that in many studies, they use it for dialysis sometimes because it seems to be very forgiving to the cells because they're going into tubing. And they use it in open heart surgery when they do an open heart case where they use the heart-lung machine. So that's much more forgiving to the cells. And then we get into something called vibrational medicine, which is a whole new field that we're going to start getting into. All cells in the body and organs and things have frequencies. And if we can produce these similar frequencies with light, basically pulsing on and off, we may be able to stimulate these things. So now we're going to be stimulating with not just light, but also with the ozone. So we have a dual effect. And the other thing I should mention about light, for instance, when you're looking at organisms, let's say like a mold or a Lyme disease or something along those lines, you're basically using 2 or 3 methods to kill these organisms. Number one, the ozone. What the ozone does is it goes and literally melts the envelope, what we call the lipid envelope around the organism. So it exposes their DNA and RNA, and that just basically is the end of the cell, so to speak. Also, what we have is ultraviolet A, which is a stress. Basically, it stresses the cell a little bit, and I'll get into that in a little while. Then we have ultraviolet C, which is very toxic to these things. But luckily, the dosages of these lights is not enough to harm regular cells. But it can really harm the viruses and things like that. Another thing to get into, so to speak, kind of just keep talking, I guess, so to speak, is that, as we age, viruses that we had as a kid, such as Epstein-Barr and CMV, that we kind of didn't even think much about, become more and more prevalent. And this prevalence starts to produce more and more viruses. And we then start getting something, again, called inflammaging. So that's an important aspect of things also. So there's so many things that we're learning. And the virus part is just, something that we've kind of picked on recently. We knew it took care of viruses, but we now know it's going to diminish your viral load. And that's a very important thing. And you're going to see more and more on that as time goes on, how diminishing the viral load in people, because we all have viruses in our bodies, is going to be very beneficial for your health.
Awesome. So you gave us a lot of information on ozone, which is awesome, and then also our hemolumin light device and all the benefits of that. But a couple more components of the EBO2. Can you touch on the benefits of oxygen?
Okay. We can't live without oxygen because what we have is something called oxidative phosphorylation. What does that mean in English? It means our mitochondria, which are the powerhouses of the cell, they need to use oxygen to produce ATP. Now, we can produce it without oxygen, but it's very inefficient. For instance, to give you an idea, numbers-wise, when our mitochondria use oxygen, it'll produce 36 molecules of ATP. When it goes on something called anaerobic glycolysis, it'll produce 2 molecules of ATP. So that's why we need oxygen. But the problem with oxygen is it causes something called oxidative stress, meaning that it causes something called a free radical. Now, free radical is sort of like a little terrorist in your body. It really is born to do harm. It, is convinced it wants to do harm to you, and its motto is it wants to harm you. So if you can quell these free radicals, that's an important thing. And we basically have many different processes to do that.
Awesome. And then the last piece is the blood filtration piece. So to my understanding, the blood filtration really lowers that viral load. Would you say that's accurate?
No. So the ozone is what's taking care of the viruses, but we're filtrating by size, essentially. So we use a regular dialysis filter, which we actually flip upside down. So we leave molecules like electrolytes and things that would be in excess in a dialysis patient untouched. Those would be vital to our survival, obviously. We leave those untouched and we filter larger molecules such as fats, cholesterols, heavy metals, toxins, and inflammatory proteins. And the most important, I would say, is the inflammatory proteins, because as we're killing off those viruses, bacteria, yeast, etc., mold that are causing this inflammation in the body, we're kind of dually attacking it by taking the inflammation away as well as killing these microbes.
Okay. Cool. See, it's complex. That's why I wanted to do this podcast, because even I'm, not a medical practitioner. You guys do this every day, and I think it can be a lot to absorb for people to understand the benefits of it. Okay, so that kind of leads me to my next question. You mentioned mold and all of the things that we can be attacking. Who are you seeing, Bella, as like the patients that benefit most from this treatment?
With 1 or 2 protocols, typically we'll see a generally well patient, someone looking for longevity, anti-aging, etc. They'll do really well with 1. Sometimes they'll finish and say, wow, I can see clearer. I have more energy. I hear things sharper. It's really interesting.
Yeah.
So that's kind of a very cool thing to see right away. Obviously, our autoimmune, our Lyme, our mold patients are going to take a few more protocols to kind of achieve the same or similar results because they're operating with a higher level of inflammation. So once we kind of get going with them, they do really well. I would say Lyme, mold, autoimmune conditions, chronic inflammation, those patients do really well if we do about 3, so once a week for 3 weeks. And then as needed thereafter, but usually they'll fall into the quarterly or biannually kind of population.
Right. And for that generally healthy, maybe high-performing person, whether it's a high-up CEO or a marathon runner, somebody who's really pushing their body on a regular basis, but they're not necessarily a professional athlete, and they don't have any diagnoses of any kind, we typically recommend that quarterly treatment.
Yeah, I would say at a maximum of about monthly. You don't really need much more than that.
Right.
But monthly to 3 months is fantastic.
Right. And I've heard a lot of people say, if you've been traveling to multiple countries on a plane, multiple planes for the past few weeks, that's a great time to do that treatment. Would you say that's accurate?
Yeah, we're getting a lot of radiation in the air and our bodies are going through a lot. So once you get rehydrated after your flight, come on in and get it filtered.
Yeah, I love it. Okay. The other thing I wanted to ask you, Bella, is, so you're in the field every day. You get asked a lot of questions by doctors. And one of those prominent questions is, how does EBO2 compare to EBOO? Because a lot of people think they're exactly the same thing. And while they're very, very similar treatments, there are differences, right?
Yes. So the premise of both is the same. We have an IV in each arm. We're using ozone. We're filtering blood in some way or another. But the difference, there's a few key differences, actually 3. So our EBO2 utilizes a higher dose of ozone. So our therapeutic range of ozone that's been studied is between 10 and 30 gamma. Gamma is the unit of measurement we'll use here. So we start a patient at 15 gamma and we increase them to 26 after they prove tolerance to that 15. EBOO or EBOO, they call it, they start the patient usually at 2.5 gamma and bring them up to 7. So we're saying that our threshold to start our therapeutic range is 10. So they're just below that. So as maybe they'll get some good results over time, we're typically seeing results faster because we're within that therapeutic range. The second difference is we're filtering or ozonating, I should say, a larger volume of blood. Okay. So they're doing 1 to 3 liters and we're doing 4 to 6 liters within the same time period. So typically a patient will have 5 to 7 liters in their body. So we're doing quite a large volume of that. And the third thing, which Dr. Purita touched on quite a bit, is we're using the hemolumin photobiomodulation device. So this is really important in that we're providing the 6 light wavelengths that he spoke about. And we actually have the ability to pulse and we can target the frequency to a certain disease or whatever's going on with the patient. So say the patient comes in with Lyme's, we can open up our manual and say, this is the perfect frequency to target what they have going on and then set it up for them. So they're getting a targeted EBO2 rather than just kind of what everybody gets. The light device that EBOO, there's many different EBOOs, but many of them are using has one straight line of tubing, essentially. I think it's about 10 inches. Ours is 30 inches of quartz, so the lights penetrate quite deeply. They're also lacking, obviously, the pulsation and the 6 wavelengths that we're using. Usually they're using 1 or 2.
That's awesome. Yeah, I feel like over the years, because the hemolumin has come a long way over the years, I felt a big difference in the EBO2 treatments I got 4 years ago as opposed to now with our most up-to-date hemolumin. That's awesome. That's awesome.
I remember our old... just to kind of give you some idea, when I first got that idea to put lights in it, I designed it with a 3D printer, and I put in little mirrors in the inside, and I said, oh, okay, this should work. But I said, but like anything else, you make it better. Yeah. One other thing I want to mention to our audience, there is another type of blood ozonation product. It's called 10-pass.
I was going to ask you about that next.
Perfect. See, I read your mind.
Yes, you did.
So anyway, what is 10-pass? So 10-pass is, well, they'll take some blood from you, in a syringe, and they'll put about 200 cc's of your blood in an IV bag. Then they'll put ozone gas in there, and then they'll shake it up to hopefully get an interaction between the blood and the ozone. And then they'll pull it back out, and then they'll put it back into your vein and have it circulate in your body. There's a lot of problems with that. A couple things I can think of. First of all, when you start shaking blood, anytime you start shaking your red blood cells, they start lysing, they start breaking up. Not a good thing, first of all. Secondly, when you look at the interface between an IV bag and what we have in our filters, for instance, an IV bag, the interface between the blood and the ozone is maybe 5 or 6 square inches. In our dialysis filter, the interface is 22.5 square feet. So you're getting a tremendous amount of interaction between the blood and the ozone where you're not going to get that in an IV bag. That was great. At one time, that was the only technology there was. But it's old technology, and why would you do something that was, from the 1940s when you have something from today? So it's not a process that I would recommend to anybody. Better than nothing, but certainly not very good.
Yeah, I've heard a couple of you guys say that an ozone 10-pass is probably like a 10th as effective as EBO2, right? So you would need 10 passes to get the benefits of one EBO2, and you still wouldn't get all the other.
And the damage you do to the blood.
Right.
Yeah. And remember also that infrared light is really helping to preserve those red blood cells.
Right. And then what about, I've seen ozone saunas, I've seen ozone insufflation. What's the deal with those?
I kind of question some of the science, okay, because I'm just saying, well, again, ozone's a fairly toxic compound. You got to be careful not to breathe it. It can really cause damage to your lungs. So I'm always a little leery of some of these other type of treatments. I mean, this is something that stood the test of time, and it seems to work well. So I would, at least myself, I'll steer clear of those things. I have no desire to do them.
Yeah. Can we talk a little bit about personal experience? Because Bella, I know you had a really remarkable personal experience, which is actually why you got into this field and why you have the role you have today. Can you tell us a little bit about the first couple times you did EBO2 and why you did it and the outcome?
Yeah. I initially did an EBO2. I had some friends who were doctors or patients of Dr. Purita, and I just tried it out. I didn't really put out much as far as waste was concerned, just a little bit of like a clear fluid, and I didn't see much of a difference. I was healthy. I was 25, I think, at the time. Subsequently, I got a COVID vaccine, and I ended up with myocarditis. So within a few hours of getting the vaccine, I was having stabbing chest pains. I ended up in the ER with a whole gamut of symptoms, but they wanted to give me steroids, etc., which obviously I wasn't thrilled about. So I came back, saw Dr. Purita again for an EBO2, and I ended up filling up the 3-liter waste canister with foam, which is inflammation, and I never had chest pain again after that. So going from being told I needed all of these steroids, and of course my first thought is, I don't want to get fat, I'm not taking steroids, my chest pain is fine. But I came here, I did one treatment, it took me 45 minutes, and I was better, and I was shocked. So then I talked to the man next to me, and we got things rolling.
Right, because you were an ER nurse before, and I remember, so Bella and I have known each other a really long time, and you loved being an ER nurse, and that was kind of your zone at that time, but I remember you kind of having this like awakening moment of like, wait a second, I need to take a closer look at this. I want to spend more time with Dr. Purita. And yeah, now, once again, you train doctors all over the world on how to do this. So it's like, there's no one more passionate about this treatment than you, in the way I view it.
It's awesome.
Yeah. Which kind of gets me to my next question, which is, how does getting trained by you work on this treatment? Say there's other doctors or clinic owners listening to this. What does that look like from beginning to end?
This is actually another key difference between ourselves and other protocols within the EBO2 or EBOO realm. We offer 2 days of personalized training in your own clinic. So no matter where you are in the world, we'll come to you and we'll train you for 2 days. So that is 3 patients per day with the EBO2 protocol, as well as a didactic and setup portion to train the staff fully. And then we offer ongoing support so we can help you anytime, day or night, whenever you have an issue.
Awesome. What else do you guys wish people knew about EBO2 in terms of questions you get asked all the time? What do you think is kind of anything you want to myth bust?
There is a lot of confusion with the 10 pass and EBO2. I think that's the biggest thing, what makes EBO2 different. And he got to that quite a bit, but I'll highlight there too that a 10 pass is kind of ozonating 2 liters of blood. Whereas, like I said, we're doing the 4 to 6 liters. And I think another myth is that EBO2 is this big like detoxification protocol. So a lot of our patients and physicians alike are worried that after the protocol, the patient's going to have a big kind of Herxheimer reaction. And for those who don't know what a Herxheimer reaction is, it's kind of like a die-off effect. If you use something like Ozone or any supplement to detox and kill off a lot of organisms in the body, and the body doesn't have a way to get rid of those, they'll kind of build up in the system. And you'll have symptoms like headaches, flu-like symptoms, etc., presenting differently for many people. But I think a lot of people have the misconception that that's how you're going to feel the day after EBO2. And we can clear that up by saying that EBO2 is kind of like a low and slow protocol. I usually compare like a high dose ozone to kind of like throwing a steak on the grill, whereas EBO2 is kind of like doing a slow roast, because we're using lower doses of ozone, but we have the filter where the ozone and blood are mixing, which he said is feet rather than inches of area in there. So patients typically feel well the next day, maybe a little bit tired, no really issues with a detox effect there.
Okay.
But if we do have a question of someone maybe going to detox, we've created a compound called HeartShield. We basically put these little patches over your 2 arteries here, and they have the ability to have that medicine drift down into the arteries and get into your body, and it can really help affect that if we need to. So it's not a problem.
And how does someone prepare for a treatment? Should they come fasted?
Fasting? No. What we found with EBO2, now, not necessarily the first time, but after that first treatment, maybe the second or third, we'll see a precipitous drop sometimes in the blood sugar. Now, we're very vigilant about that. We'll basically take a little bit of your blood from a finger and we'll check it, or we'll take it from the IV line and see what your blood sugar is. And if we have to, we'll have you drink juice, or we'll just give you some intravenous, what we call dextrose, very high concentration, basically sugar. And that can help take care of it. What does that mean, though? It means that the process is really doing its job. It's stimulating something called another pathway, AMPK pathway, and also blocking mTOR pathway a little bit. These are pathways that can really, like AMPK is one of the most important pathways in your body. This is a nutrient sensing pathway. It controls so many other pathways in your body. If that pathway is working very efficiently, you're a healthy patient. Okay. And what this does is it can drive glucose into the cells, into the muscles, and utilize the glucose better. So we know that we're stimulating that pathway because we can see the difference from one to the next. So that's a very important aspect of things. It took us a little while to figure it out exactly, but we know what that does, and it's an important thing. And that's why people take some of these supplements. The new supplement that's out there that's kind of the rage now is berberine. And berberine stimulates the AMPK pathway. And those of you that know metformin, that's also a stimulator of this pathway. So things like that.
I love that. And then we talked about a little bit of what patients this treatment can be so beneficial for. Obviously, anybody with any kind of chronic inflammation, it's great for them. Is there anyone it's not for?
Good question. Patients who are pregnant or lactating, less than 16 years old, this is an adult treatment. It's an adult blood volume. We only treat adults. In the case of a very large child, we can take that case by case. But any clotting disorders, we exclude. Obviously, we're filtering and ozonating the blood outside of the body. So we don't want to put anyone at risk for clotting. Any moderate anemia, moderate to severe anemia, and low blood pressure, really, and that's it. But most patients are a candidate.
Awesome. Well, thank you guys so much for being here today.
Our pleasure.
I think we provided a lot of really valuable information. I learned some. So yeah, thank you guys.
Awesome. Thanks for having us.
Very good.
All right.
Have a good day, everyone.
Bye-bye. This podcast is brought to you by PUR-FORM, a comprehensive wellness center in Boca Raton, Florida. The website is purformhealth.com, or you can find us on Instagram, Facebook, YouTube, or TikTok at purformhealth. Feel free to message us with any questions, and note that you can connect with our providers for consultations over Zoom for everything from stem cell therapy to hormone replacement therapy and peptide therapy. That's it for this episode of the HealthSpan Collective. We hope you found it insightful and inspiring. Don't forget to follow us wherever you listen to podcasts so you never miss an episode. And if you enjoyed today's conversation, we'd love for you to rate, review, subscribe, and send it to a friend. It really helps us reach more listeners like you. And we'd also love to connect with you on Instagram. Follow the podcast at HealthSpan Collective and me at Nicole J. Doran, and leave us a comment on our latest post letting us know what you'd like us to cover next. Until then, have a beautiful day.